What should I expect during my baby's first month of life? Well, we're going to go over some sleep patterns, poop patterns, and what's normal versus what might need a closer look. If you're a new parent or just want a refresher, this video is for you. Hi everyone, I'm Dr. Lavanya Sathananam, a pediatrician and mom, and you're watching the Park Pediatrics and Park Travel Clinic channel. If you want to stay in the loop with the latest expert pediatric and travel medicine information, please make sure to hit the like and subscribe button below. So let's start with sleep, because that's usually what you as parents are missing out on the most. Newborns sleep a lot, but not all at once. On average, they sleep about 16 to 18 hours per day, but in short bursts, usually 2 to 4 hours at a time, day and night. This happens because babies haven't developed their circadian rhythm yet. They don't know the difference between day and night. That means at 3 a.m., it isn't unusual for a 2-week-old to be awake. And remember when your baby was inside of you, you were walking around usually all day, and that was very soothing to your baby. So they would be asleep. And then at nighttime, when you weren't moving, that's when your baby was kicking and moving around. So that was the time that they were awake. So they stay on that rhythm for the first few weeks or even months. So that you have to kind of undo with time. And we'll talk about how in a bit. So here's some tips for sleep survival. Keep nighttime feeds quiet and calm. That means low lights, no stimulation. During the day, however, keep the lights on and talk to your baby to help them start sorting out day versus night. Always place your baby on their back to sleep on a firm, flat surface with no blankets, pillows, or stuffed animals. This reduces the risk of sudden infant death syndrome, or SIDS. If your newborn sleeps less than 12 hours total per day or seems impossible to wake up for feeds, let your pediatrician know. Okay, next up, poop. And yes, we're gonna talk about it. In the first few days, your baby will pass meconium, which is black, sticky, and tar-like. That's normal. By day 3 to 5, it should change to a greenish brown, then yellow, seedy, or loose type of stool, especially if you're breastfeeding. So what's normal? Breastfed babies can poop after every feed or only once every few days. Both are normal as long as stool is soft. Formula-fed babies usually stool 1 to 2 times daily, and it may be a bit more formed and tan in color. You should call your pediatrician if baby's poop is white, pale gray, or red. If baby hasn't pooped for more than 1 week, stools are consistently hard, dry pellets. There's a lot of mucus or very bad odor with very, very watery type of stool. Also, lots of gas, grunting, and funny faces are normal. Babies are still learning how to poop. So what's normal with eating? Most babies will feed every 2 to 3 hours around the clock. That means 8 to 12 feeds per day. And breastfed babies may cluster feed, feeding often in spurts, especially in the evenings. Formula-fed babies typically eat 1.5 to 3 ounces per feed by week 2 and slowly increase. Signs your baby is getting enough to eat: at least 6 wet diapers daily, steady weight gain, especially after the first week of life, seeming satisfied after feeds, like taking a nap, not crying. Call us if your baby is extremely sleepy and you have a really hard time waking them up for feeds. If you're seeing fewer than 2 or 3 wet diapers in a 24-hour period, or if your baby is having trouble gaining weight and hasn't regained their birth weight by 1 week of life, or has lost more than 10% of birth weight, then we really need to know. So when should you worry in that first month? There's a lot that's normal in the newborn stage, but here's some signs that you should call your pediatrician or seek some urgent care. So if your baby has a fever over 100.4 degrees, this is considered urgent. Poor feeding, refusing most feeds, or having very strong, forceful projectile vomiting after most feeds, then that's considered something we need to know about. Fast breathing, grunting with breathing, or any change of color like having like a blue or very pale appearance. Excessive sleepiness, if baby is limp or hard to wake up. Persistent yellowing of the skin and eyes past 2 weeks. This could be jaundice that needs further evaluation. Umbilical cord with a lot of redness, especially around the cord, or very foul odor or pus, then let your pediatrician know. Trust your instincts. If something just feels off, it's okay to seek guidance from your pediatrician. So what else is there to expect? What are some normal newborn kind of signs or things that might surprise you? So peeling skin. This is very normal. Most babies will have skin that peels, especially around the hands and feet, sometimes their whole body. Baby acne. Those little red bumps on the face usually pop up around week 2, and there's no need for concern or even creams for it. Sneezing and hiccups. This is very frequent and normal. It doesn't mean your baby is sick or cold. Noisy breathing. Newborns often sound like little tiny dinosaurs when they breathe or sleep. They can make a sound like they're congested. As long as they're feeding and growing, it's usually not a concern. Startle reflex. If your baby suddenly flails their arms out when startled, that's normal too. It's just a sign of their immature neurologic system. So the first month can feel overwhelming, but you're doing great. Remember, every baby is different, and it's okay to have questions and ask your pediatrician if you have any concerns at all. At Park Pediatrics, we're here to support you every step of the way. If you found this video helpful, give it a thumbs up, subscribe, and share it with a new parent in your life. Thanks for watching, and I hope you find the other videos that we've done on other newborn and other pediatric topics to be helpful as well. Thanks for watching, and see you next time.